Hi, I'm Dr. Stephen Stokes and welcome to the channel. Today we're going to talk about cold sores and canker sores. They present in different ways, although they're likely both caused by the herpes simplex virus. So a canker sore is usually found on the inside of your mouth, and they're little white blisters, sometimes little yellowy white blisters, and they go through a period of about 5 to 7 days. They'll usually end up with an eruption where you have an actual erosive sore in your mouth. They're super painful. For a lot of people, they occur when they eat things like potato chips and sharp types of foods that irritate or slightly cut the lining of the mouth, and you get these eruptions. The cold sores appear on the outside of the mouth around the lips, and they can also appear on the genitals. And these follow a similar path and are very painful, especially the cold sores because they're visible, so it really can affect people's lives where they don't want to go outside when they have them. Now, there's good and bad news. So the bad news is that if you get these conditions, if you get these symptoms, I should say, then you're likely never going to be free of them. It's a viral infection. It doesn't go away. You get it for life, basically. The good news is that there are ways to really suppress the symptoms. To understand the mechanism here, you've got to understand calcium and its job in your body. So vitamin D pulls calcium from your gut and puts it into the bloodstream where your body can use the calcium. Polyunsaturated fatty acids take the calcium out of the bloodstream and put it into the soft tissues where it can be used for, among other things, healing, and stimulating the immune system. If you're getting these outbreaks with either cold sores or canker sores, you are having a tissue calcium starvation, meaning the calcium is not getting from the blood into the tissues, which means that you likely have a polyunsaturated fatty acid deficiency. So what do? Well, if you get canker sores, as soon as you feel the canker sores coming on, take calcium lactate tablets. Take a handful of them, 4 or 5. Put them in your mouth. Suck on them. Don't swallow them. Suck on them and let them dissolve inside your mouth so the calcium is readily available in that area. Then take something called Cataplex F, which is a great source of polyunsaturated fatty acids. Together, this combination will suppress those symptoms and stop those lesions from occurring right in their tracks. Of course, if you're getting the cold sores on the outside of the lips, same thing, except you want to swallow the calcium lactate. So you want to make sure you've got lots of calcium and lots of polyunsaturated fatty acids in your system to counteract the calcium tissue starvation. Another thing I recommend you do is you take St. John's wort as a liquid extract from MEDI-HERB, and it's a purplish liquid. You can take the St. John's wort, take a Q-tip, dip the Q-tip end in the St. John's wort, and dab it on the actual cold sores on the outside of your face, or if you have them on your genitals, you can apply the herbal remedy right on those sores. Now, why St. John's wort? Everybody knows about St. John's wort as an effective herb for depression and anxiety, right? It's a mood modulator. What people don't realize is that St. John's wort is a super antiviral herb. So it really does a great job of destroying capsulated viruses. And capsulated viruses are viruses like herpes simplex, right? So this is a great herb if you suffer from herpes or if you suffer from these different symptoms as a result of that. You can ingest 5 milliliters of MEDI-HERB St. John's wort per day. Just take a little bit of it in a shot glass, mix it with some water and shoot it in one shot. Doesn't taste very good. Or you can, as I said, take the full strength, dab on it, and apply it to the lesions on the outside. And how it works is, and I made a whole video on this, but how it works is that the St. John's wort, it breaks down the encapsulation of the virus so that your immune system can get in there and do its job. So again, if you suffer from cold sores or canker sores, if you've been diagnosed with herpes simplex, these are great strategies for you. If you know somebody else that suffers from these conditions, go ahead and share this video with them. And if you want to know the mechanisms of how these different remedies work, then go to my website, realplantmedicine.com, where I have an article that breaks everything down for you. Okay, great. Don't forget to subscribe. If you have any questions, go ahead and ask in the comments section. Stay healthy, stay happy. Have a great day.